I'm really interested in the empowerment that comes from people realizing their best health through weight loss and working with people who have maybe struggled for years and years with this issue, sometimes being successful with weight loss, then putting it back on, and then finally getting to a place they didn't think they would ever be or ever stay, and that is in the body that feels like it should have been their body the whole time. That and the trickle-down effect, health-wise, that weight loss has. We see people get off medications that they've been on a really long time. We see some pain conditions improve. So just the overall health benefits that come from being in this part of healthcare. Sometimes it's the spark. Somebody knows they want something. They want weight loss. They want better health, really, through the weight loss. Some people are looking for improved quality of life. Some people are looking, just to get into clothes they haven't been able to fit into for a really long time, so whatever it is. But the motivation, the desire, isn't always enough. We need more than that. We need the knowledge of what to do sometimes, of how to get there from where we are now. And even then, the knowledge isn't enough. We've got to have the skills. And that's where we can really come in, is the knowledge side and the skill side, because the desire is already there. So when I talk about skill building, it is, sometimes it's, well, how am I going to actually, I know I want to start walking a little more, how am I going to do that? And it is really mapping it out so that it doesn't all seem overwhelming. The habit change. There's the initial habit changes that we're looking at. There are things that people want to start. There are things that people want to stop in terms of their behaviors. And this is what gets at the root of the long-term success. And that is, finding those things in our life, these habits, these automatic things that we do all the time. And they work for us. They make life more efficient for us. But some of them are really working for us, and some of them are working against us when it comes to reaching ultimate weight loss or that improved health. And so working one-on-one with someone to identify the habits in their lives, because this isn't a surgery for habits. Surgical weight loss isn't that. So that's where the patient really gets to identify and work on those things. And when somebody realizes that it is possible, I can do something different, even if I've done the same thing the same way thousands of times. On 1,001, I can decide to do that different thing that is going to support my good health. It's rooted in positive psychology, which draws on the strength that a person has and can develop more of in order to thrive. We're going beyond what they just came for, the weight loss, and moving past that suffering into what strengths can we use, build to really enable a person to have their most fulfilling and meaningful life.